Hello friends, I am Dr. Aditya GK, surgical gastroenterologist practicing in Bangalore. Today, under the banner of gastrointestinal solutions, we will discuss one more OPD based procedure called colonoscopy. As you know, the large intestine of an average human being is around 150 centimeter and the small intestine is 6 meters of length. Colonoscopy is done to look at the large intestine to see if there is any abnormality lying in the large intestine. It is a simple procedure where a camera is connected to a tube and it is passed from the anal canal and traversed all the way from along the large intestine to reach the place called a cecum. It is indicated in patients who are having long-term loose motion or having an altered bowel habit where they will have a period of constipation followed by a loose stool or a period of loose motion followed by constipation, or in patients who are having long-term pain abdomen which is not explained by any other pathology, patients having bloody stool, having mucus in their stool, patients having incontinence or where there is a prolapse of the intestine from the anal canal, and it is also done in a patients who are above 45 to 50 years of age as a screening test. It is also recommended in patients who have undergone surgery for either a cancer or any other non-cancerous diseases of the large intestine. So it is also required in them as a follow-up colonoscopy. This procedure can be done either under local anesthesia or general anesthesia. General anesthesia requires a hospital admission either as a daycare procedure or a full admission. So these patients who are undergoing with the general anesthesia require anesthetic evaluation, before undergoing the procedure. Colonoscopy requires a bowel preparation. So what is a bowel preparation? In this, the large intestine is basically cleansed of all its contents so that when the camera is passed, it looks clean to visualize the parts of the intestine. So in the bowel preparation, a cleansing agent will be given which comes in the form of either a powder or solution. So when we use the powder, for example a peg-leg powder which comes in a sachet, and this powder needs to be mixed in 2 liters of water and consumed over 1 to 2 hours sip by sip. So never attempt to drink it at once because that can produce some amount of vomiting. So try to take it sip by sip, and if the patient is getting the procedure done in the morning at around 8 o'clock, on the previous day the patient should start this bowel cleansing agent by at around 6 o'clock and try to finish by 8 o'clock. So after the bowel cleansing agent is taken, there will be 4 to 5 loose stools which indicates that the intestine is cleansed. Once this agent is taken, no solid food items are allowed to take. So patient can only take clear liquids, for example water, tender coconut water, clear juices, ORS as much as possible. If the patient has fluid restriction, suppose a patient is a cardiac patient or a kidney patient, these patients will have fluid restrictions. So in them a different bowel cleansing agent will be given, reducing the amount to 1 liter. Minimal pain and discomfort is expected during the procedure if it is done under local anesthesia, and nothing will be recalled if it is done under general anesthesia. It is not always possible to complete the procedure. Of maybe 5% of procedure will go incomplete, as it is subjected to the cleansing of the bowel and the tolerability of the patient. If the patient does not tolerate the procedure, or if the bowel is not cleaned well, then the procedure will be incomplete, and that has to be done by giving one more bowel preparation or by doing in a general anesthesia. Patients can take their regular medications with a sip of water. Only patients who are taking diabetic tablets or taking stronger blood thinners are advised not to consume it, as it can adversely affect during the procedure. And patients who are not able to understand which tablets to be taken or avoided can consult their doctors on the previous day of the procedure and clarify their doubts. Report will be ready in 10 minutes. Once the procedure is over, patients can take food or liquids immediately after the procedure if it is done under local anesthesia, or after some time if it is done under general anesthesia. Patients can resume their work if they are feeling all right after the procedure. So it is very important for the patients to understand that the procedure takes 15 to 20 minutes with minimum pain and discomfort, because the while passing the tube inside the intestine, some amount of gas will be infused to look at the intestine. And as you all know, the intestine is not in a straight line, it is a curved structure. So here and there discomfort and minimal pain is expected. So it is better to understand this before coming to the procedure, so that patient will be comfortable and will know the point at which the patient has to tolerate the discomfort and the pain. So friends, it is very important that you understand this video and you educate the people around you and your concerned ones about the procedure, and not to hesitate and postpone the procedure for a later date if it is prescribed by a registered medical practitioner, as it is very important that this will catch the disease at the earliest, at when where it is in an early stage, which can be tackled very well with the treatment modality if it is done properly at the right time. So friends, please understand this and create an awareness amongst yourself and your surrounding. And thank you very much for listening to this video. Namaste.